Thank you, Stefan. Welcome, everyone, and thank you for the invitation from the European Union to invite me to present some of the experience as national contact point when a national contact point is supporting proposals, is supporting researchers when they are submitting a proposal or preparing a proposal. So what I will give you in the next 10 minutes is some information on do's and don'ts when you prepare a proposal or some steps to a successful proposal. First of all, one question to be asked at the start is what is your motivation to try to prepare a proposal, and what are the expectations from the European Commission, as they have to fit together. So maybe you want to finance a project that you have in your mind, or you want to keep researchers in your institute or hire new ones, or you want to improve your international network or strengthen interdisciplinary collaboration. Whatever your own reason is, they have to fit into the expectation from the European Commission. And what do I mean with that? We have heard this morning a lot on the upcoming call. We have heard how important the introductory pages of the work programme are, and some of the main goals of every single project that's being submitted are the overall goals of FP7 health, which are improve the health of European citizens, boosting the innovation capacity of Europe, which is new and which is the focus is very strong this year on it, increasing the competitiveness of European health-related businesses, which you can see is reflected very clearly in the work programme by the requirement of having a lot of different small-medium enterprises in different projects, and some main other objective is addressing issues of the ageing European society. So these are more political issues that for a researcher who has a research idea might be very far removed from what you want to do. But whatever you want to submit as a proposal has to convince on a political, social, economical level, and you have to argue that the proposal really answers some of these overall goals of FP7 health. So once this step is done and your motivation is clear and the requirements from the programme is clear, we have also heard this morning that it's a very top-down programme, meaning the topics are given. A lot of areas are closed this year, will be open again, most of them next year. And once you have seen the titles of these topics, you have to consult the entire text in the work programme. So for instance, I just took an example for this one, biomarkers and diagnostics for chronic inflammatory diseases of the joints and or digestive system. You really have to read every single line and see whether your project idea can be adapted, is in focus of the topic, and can be adapted with missing expertise to fulfill what is required. We have heard also this morning that the work programme is challenge driven, so every single topic represents like a problem where you submit a solution to it by submitting a proposal to it, a whole project that you suggest can solve whatever is written and described in the work programme. So what I have here in italics, you see, this requires, in this specific topic, early diagnosis is required, the establishment of the mechanism of initiation, the identification of genes, and it goes on, and it says, as well as identification of targets for therapeutic action of pharmaceutical agents. So there's a lot of different expertise required in this project and a lot of different research, which brings us back later on to the comment how important the consortium is, because the consortium, the constellation of the consortium and the amount of partners you have in the consortium should exactly reflect what is required here. So you have more, you have more requirements, you know how large the project for such a the budget, the EC contribution for such a project can be, and then you have the expected impact, which then further describes what the project's goal should achieve, and then specific feature, which is a very important part in this year's work programme. And you can see for this specific topic, it's 15% of the budget from the European Commission has to go to small-medium enterprises, which is the innovation aspect of the project, which really has to be covered. So the second step of success is that your project idea fits exactly into the work programme and is, in the EU jargon, is in the scope of what's required. The next step is you have to ask yourself, what is my role for the project? Do you want to become coordinator, work package leader, partner? There's some questions that have to be answered for that step. first of all, some general question is the idea unique? Your idea has to be unique and discuss it with your colleagues. Is it a real challenge? Check the literature. Does it require European cooperation? The FP7 Health Programme is a European programme where it's not sufficient if you have excellent expertise of 1 or 2 countries. We have heard the minimum rule was 3, but you also have to show that really the research expertise is coming from different countries, that this is an approach which goes further than your own country's border. Then the next question is, can or do I want to take the leadership, which very often is then also that you are willing to write a proposal, that you are willing to be the contact person to the Commission, that you are in the leading role of the project. And what I mean with the last, am I willing to sell my idea? This is a research proposal submission, but it goes further than research. You have to sell a product. You have to sell something that convinces on every different level, on the scientific research, scientific excellence, on a socioeconomic level, on a sometimes political, on an economical level. So, back to the next step is the consortium. We have heard that as well. We shouldn't have a consortium should not have too many partners. Every single partner has to be important for the tasks that are carried out in the project, and they should have complementary skills. So you should have as many partners as you need to carry out the job that you want to do. You don't need 3 bioinformaticians or 3 ethical experts if it's sufficient to have one of this expertise in your consortium. As I mentioned before, the international or the European approach must be evident. From talking to evaluators, to experts that read the proposals during the evaluation, it can be a plus when you show that you had past collaborations with some of the partners. This does not have to mean that you have to have past collaborations in a framework, but if you can show that some of the researchers have worked together previously, it can provide trust that you know how to work with each other, you understand each other, and your past collaboration resulted in publications, in patents, in other projects. As we have heard, the Fit for Health is a database where you can find partners, and it's relevant to include small, medium enterprises, industry, and patient organisations whenever it's required in the text. Then the next step, of course, is the eligibility and the evaluation criteria. Most of you know them. I just want to point out some specific new points for this year. Some eligibility criteria or exclusion check are related to specific topics. When you read the work programme, you can see for some topics the duration of the project is limited and is given. Some say how many partners you can have in a consortium as a maximum. And as I said before, the percentage of funding that should go to the small, medium enterprises. And all this is eligibility criteria, meaning if you do not fulfill these criteria, it's a pity for all the work you do afterwards preparing the proposal. Regarding evaluation, the scientific and technological excellence is the most important evaluation criteria for you as a researcher, and there you need to get a score of 4 out of 5, but this is only one evaluation criteria out of 3. The next one is implementation, which really is where it's looked at what is the quality of the consortium. Is every expertise needed? Are the partners, the competencies complementary? Do they complement one another? The quality of the management, which is how are decisions being taken, how are in the consortium, how are the deliverables being brought forward. Implementation is also an evaluation criteria where you have to reach threshold of 3, and if you don't, it's a pity for your excellent science that you may have had in your proposal. And the next step, the next evaluation criteria, the impact becomes more, is in this year's call very important and has a new aspect, which is new compared to the last year's call, and it has a very strong focus on innovation, the socio-economic impact of the project. So the innovation dimension of the proposal really has to be convincing. And you have to identify and address exploitation issues. Now, for all the proposals that will be submitted this year with a leader from academia, It's really, really recommendable if you let the SMEs that are in your consortium help write this part, because that's the people that know how to write the innovation dimension and to be convincing in the impact. There is a help in the work programme. You don't only have the topic description, you have also the expected impact that the project should have, and you have to build up on that. And you also have to convince from a point of view, or to show how you disseminate the results, how the intellectual property right management in the consortium between the different partners is handled, how you handle the patenting, the preparing of standards and issues like that. Now, in the next 2 slides, which are nearly my last 2 slides, I have some very specific points, tips, recommendations, or do's and don'ts for you, which are from reading proposals, pre-screenings, which NCPs do, and also from evaluators that say these are weaknesses that are very reoccurring in the submitted proposals. So, really, your project has to be in scope. It has to, the proposed work meets the topic addressed by the call. There is a guide for applicants, which is really the guide that tells you how you have to write the proposal. And this is not just blah blah. This guide really tells you how many pages for which section you have to write, and that's the amount of space that you have to convince what you want to do, to convince the evaluators. Be as concise and as precise as possible. You don't do anyone a favour if you submit a huge amount of work. It has to be read and it has to be evaluated. Then, as I said, the consortium of partners must be excellent and appropriate to the task, which is defined in the work programme. The objectives have to be, they shouldn't be overcrowded. They should be very clear, focused, and reflect the topic in the work programme. Don't have too many objectives, because you can run the risk that the project is being gets a low score by being over ambitious or not realistic. We've heard that this morning, and I was asked to mention that today as well. For the proposals with clinical trials, epidemiological studies, or wherever applicable, an appropriate study design is needed. Information on data processing and statistical analysis of data. We have heard all the projects are being submitted with a 2-stage. So the first stage is 7 pages, and that's very little space to give this detailed information. But you really have to try to give very detailed information on the study design, on the statistical analysis that you want to carry through, and outline the methods as well as the collection, handling, and number of patients and control samples. Challenging on 7 pages, but that's what's required. One section in the proposal that's very often ignored, or in the last minute of rush of submitting a proposal to the deadline, is to overcome the potential risk, the so-called contingency plan. Try to convince the people that read your proposal that, of course, research is risky, but that you have some preliminary data or some idea how you can avoid or minimise certain risks. An advisory board with a patient organisation, if you work with patients, or with an ethical expert, is very recommendable. And the ethical issues have to be addressed, and do not forget the 3 evaluation criteria, or the 2 non-scientific evaluation criteria. And last but not least, this has nothing to do with excellent research, but your proposals should really be easy to read. The evaluators are researchers that read these proposals after being in the lab, or after having done their own work, and help them provide the information the way that it's easily structured and that it can be found. And Health NCPs, we are here to support you, and via the link you get the Health NCP of every single country. Now, my very last question is, if you can convince in your proposal, in the first few pages and in the abstract, you can answer these questions, you're already gone a long way towards successful proposal. So what problem are you trying to solve? Every topic is challenge driven. It's a problem that's predefined. So you provide a solution to what's in the work programme. You convince that it's a European problem, that it's a European approach that solves this, or that provides a solution. Say why you are the best people for this job and why this project needs to be carried out now.
Thank you very much.
Sorry, thank you for your attention.
Thank you, Sasha. I think this was a very complete checklist of all the things you have to do. And it may not surprise you that this is one of the factors why Switzerland is so successful in our program. So thank you again. And now I'd like to invite the next speaker, who is Claudia Giel from the IPR Help Desk, Senior Program Manager for Life Sciences. Thank you.